Why do Americans not go crazy over not having a free healthcare? Americans don't seem value collective good very strongly in general. In countries with socialized healthcare, you need to have public buy-in to the system. There must be a belief that it's good for the collective to all have access to healthcare in order to make healthcare taxes etc. work. Most countries accept this and understand that paying for 0.00005% of someone else's heart surgery is the trade-off for you getting a free knee replacement. But America is founded on the ideals of individual exceptionalism, and this is counterproductive to the idea of a collective good. So the system is built as it is, and any time someone tries to dismantle it, it's shot down by insurance companies with too much to lose, corrupt politicians who want to fund taxes into guns, war and hate, and the people who have bought into the ideals of America being the greatest country in the world. Nobody has free healthcare. What's different is how it is paid for. We in Europe are comfortable with paying for a healthcare system through taxation that it then free at the point of delivery. Why Americans prefer the system they have is a total mystery to me. Because a appointed and successful disinformation campaign by the insurance industry. They've convinced folks here that people in other countries wait months to get seen by a doctor. Which is hysterical, because people in the US also have to often, wait months to see a doctor for non-emergent and elective care. They've convinced people that the government will be making your healthcare decisions, not your doctors, completely ignoring the fact that your insurance company essentially makes healthcare decisions for you based on what they will cover. And by extension, your employer makes healthcare decisions for you based on what insurance plans they choose to offer, and what drugs the formulary plan they opt in to cover. I'm a healthcare worker who no longer practices because of how awful our system is. I just can't participate in it because they still have one of the highest standards of healthcare in the world. And the only people who do not have immediate access to healthcare are the poor unemployed, a group which tends not to have much power. I say this as a European who supports public healthcare. By the way, also I wouldn't expect this post to be downvoted at all. It's the majority opinion on Reddit lol. Also, American health insurance companies will deny coverage for procedures and drugs they deem unnecessary or too expensive. They overrule doctors frequently. I'm irate with United Healthcare for not covering my last month's worth of insulin. Because we can't do anything about it. Guys, for real, we can't even get daylight savings time killed even though it's universally hated and relatively simple to end it. Most Americans unfortunately have the me-only mentality. I had an argument with someone some time ago about this and I said everyone would definitely benefit from free healthcare. The person's argument was why should someone pay for someone else's medical bill? I didn't see it that way. I saw it as everyone contributing to this big pot so everyone can get treated should the need to. Because our government will never stop taking money from big insurance, big pharma, private hospitals, etc. If that would change, then maybe some of these asshats would vote the right way and help out the common person who goes massively in debt if they have something wrong with them. Downvotes are coming big time. 'Cause they say we don't have free healthcare and we pay for it by our taxes. Like they don't have taxes LMAO. And they think they earn so much more with this system than we are. Europe, also. They are convinced their work culture is healthy and they just need to be very successful. If one can't afford not dying, it's the fault of that one person. But that's just what I gathered from Reddit from so many Americans arguing about it. I don't give a damn about changing anything in the US. I can't believe it is seen as something normal that someone who doesn't have enough money to get treated will die. It isn't. The whole "grandma will literally die if she doesn't have free healthcare" narrative was invented by histrionic Redditors. No hospital is going to turn away somebody who is in need because they don't have a good enough credit score. The absolute worst case, which happens incredibly rarely, is that someone who made a conscious decision to not pay for insurance has to declare bankruptcy if they have an expensive medical emergency. There's a vanishingly small category of people who are unemployed, have no savings to cover a large expense, no access to credit, no insurance, and who actively choose to not seek out healthcare because they would rather die than go bankrupt. But it's almost certainly smaller than the number of people who die because the NHS put them at the back of a waiting list, and rectifying it was completely within their control. Some of us just die because of it. Because everyone falls in love with the free healthcare moniker, and it completely bulldozes the standards for any metric provided in the process. Socialized medicine piggybacks off of American healthcare primarily in two facets: research and development, and a lack of need for national defense spending. Without American R&D driving down the cost of most run-of-the-mill medicines and medical procedures, countries providing socialized medicine are not able to afford to operate, which leads to medical boards convening to determine who gets to receive which procedure and who potentially dies. From the national defense standpoint, American military strength is obligated by treaty to provide military assistance for nearly a third of the world. Is that those countries' fault that they don't have to spend money on their own defense? No. But to look at each country's situation and think that it can be copy-pasted onto every other is a very simplistic way of determining policy, to say the least. It's much easier to afford other spending on programs like free healthcare when a massive swath of other countries' required spending is simply absent from the budget. Our protests don't go that way. We can't just light a few cars on fire like France does and get whatever we want. Our protesters get gassed and shot in the streets. Greed. We have been socially conditioned by corporate propaganda to reject most forms of collective power. I think half of the population has been brainwashed to think that it is a commie thing to do. Corporate greed. I think the difference is the misconception of no care. There is not a place in the US that will not help you. We have the best healthcare in the world, but you'll possibly be billed crazy amounts because we haven't figured out price negotiations. It's more complicated, but the misconception is there's no healthcare. BC Americans are brainwashed to believe healthcare is evil socialism. They care more about Donald Trump versus Biden than anything. Constant suffering at their own fault, but blame Biden, Hillary, or Trump. There are people who make a lot of money under our current system, and those people have a lot of influence in politics. People in the US are more likely to protest over cultural issues, and those with the most resources want to keep it that way.
If you enjoyed this video, please check out our playlists full of similar content. Epicaricast is like doom scrolling for your ears. Please like, share, and subscribe.